Warriors. It's a rape trauma group for women age of 18 years of age and older. What our ideal goal is, we want our clients to find their inner strength, to build self-efficacy while also building their self-esteem, to be able to reduce anxiety symptoms, depression symptoms, and gain psychoeducation about trauma related to sexual abuse and rape, and gain coping skills that will allow them to maintain and achieve their goals while also being able to reach their fullest potential in life.
The purpose of our group, we want to provide a safe space for women to talk about their experiences, and we'll focus on teaching and implementing coping skills to work through their trauma. We will also be utilizing cognitive behavior group therapy. The purpose of this is because we realize it's not just the psychological aspect that we're going to work on with these women, but also the social aspect and how they go about their daily lives. So the purpose is just to enhance their lives in general and help them work through their trauma. And we're going to have a democratic leadership because while we are facilitating the group, we want these women to know that they have a say in what we do and what we talk about. And yeah.
For agency sponsorship, an effective location to implement these rape trauma groups that we're proposing in our group proposal plan. Locally, comprehensive behavioral health would be an ideal location because they specialize in mental health treatments and interventions already. Also, another ideal facility or agency to utilize would be Meridian Services and other alcohol and drug treatment facilities locally. The reason for this is that many clients who face severe substance use disorder, they have immense trauma in their past. And a lot of their use stems from past trauma. And for the women who haven't, gotten a chance to really work on, being victims of sexual abuse and or rape, this would be an ideal location to implement this intervention for group. Also, at both the locations, they already have staffing at their agencies that are already equipped to handle and implement this intervention. There's licensed counselors, social workers, case managers. Also, medical doctors are also on staff at both locations. And both of these locations also have financial funding that are both from the government, and they also have county board funding. Not everybody has health care, insurance, or can afford it or even qualify for it. So this would give every woman a chance to utilize boarding that normally wouldn't be available, or they wouldn't even know about, to be able to get the help that they truly need.
Okay, so membership for this group, it's, as we said, it's going to be women 18 years and older. Race does not matter. The only thing that really is the main factor is that they have been through rape or sexual abuse trauma. That's going to be our main focus. And these women who are our members also, they're going to be women who experience PTSD or any other social or emotional problems due to their trauma and what happened to them. And we chose this population because we're both women, obviously, and this is a very taboo topic to talk about as women, and just in general, no one really wants to talk about it. And furthering into that, I feel like not enough people are willing to help with it because no one, is talking about it as much as we should. And so we put this fact on the bottom here that women who have been raped or sexually abused, it is very common that they have suicidal ideation and completions, and that is something that we really want, obviously, to avoid. That's absolutely worst case scenario. So we want to create this group with this population so that we can help them and avoid that from happening.
For recruitment, the local like areas that we would try to get as much like attention to for the group would be like local high schools and colleges. There's a lot of sexual assaults that happen on campuses that a lot of them even go unreported. Social media obviously is the best pathway to hit the most people with the least amount of funding utilized. Some of these agencies already have TV ads, so just sticking something in based upon that, you know, this group is available, there is help for these victims and survivors. Also, even in the newspaper, even though it's a little outdated now, that's still a way to reach other people, especially older people that maybe don't know how to utilize social media. You know, nobody is past an age level to get help for being a victim of sexual abuse. Flyers can be posted locally in hospitals, other, you know, social service agencies, and they can also be distributed through the mail. Networking with other local mental health and substance abuse agencies, referrals from doctors and other healthcare professionals and physicians, and also Children's Services Board was also an ideal place to try to utilize some recruitment for referrals. Again, there's a lot of you know, victims of indirect sexual abuse also.
Okay, so criteria for the members, as we said, you have to be 18 and over, and victims of rape or sexual abuse. Also, more criteria is women who are struggling with coping skills specifically, or if they feel alone in their experience, they could greatly benefit from the group environment and hearing other people's stories. They could maybe relate to others. So it would be really beneficial for them and they would be a good fit for the group. Women who are experiencing PTSD, depression, anxiety, self-esteem issues, or other issues related to sexual abuse trauma. They also, it's really important that in order to be a member of this group, that you are at a point in your healing process where they are able to handle and engage a rape trauma group, because what we will be talking about is so sensitive and so deep, talking about everyone's traumatic experiences. It is necessary that, you know, if you're a part of your group, that it won't damage your healing process. So this leads to the exclusion of members would include someone who is early in their healing process, that could possibly be like their healing process could be set back from the group environment, and if the group setting would not benefit them, they would also not be a good fit for the group. Exclusion also would be any woman who is currently experiencing suicidal ideations or who has recently attempted suicide. That just indicates that they might need more time individually to work on themselves, and maybe at a later time they could join a group like this.
For orientation, the things that we would be implementing would be cognitive behavioral therapy group interventions, such as trying to get like clients and members of the group who have like a sense of false reality, like thinking that it was their fault or that, you know, they brought it upon themselves, just like having like negative thinking, and it's a false sense of thinking. Cognitive behavioral therapy is a way to expose those thoughts with psychoeducation to reveal the truth about the situation so that they can see the other side, so that they can, it's actually to change their thought process. So in believing something that is a false reality about yourself, that's going to bring negative impacts upon your life, to inhibit these women from, maintaining, their fullest potential. Cognitive behavioral therapy is very successful with interventions when it comes to trauma, especially with rape victims and sexual assault victims. Also, weekly TSQ-10 questionnaires, which are personal questionnaires that the client would fill out to assess their PTSD symptoms before the entrance of the first initial group starting. These questionnaires would have to be utilized in order to create a baseline so that we can evaluate their symptoms and see if they're either increasing or decreasing. So we can see where each individual member is at and also where we're at as a group. If there's something that we can maybe implement differently, like rapid eye movement with cognitive behavioral therapy, or, because there's different types of interventions that you can use with CBT therapy. And also weekly PHQ-9 depression questionnaires to evaluate their depression symptoms also would be utilized.
Okay, so this meeting will be held for a period of 6 months. We just felt like, because of the topic that we're going to be working on, a longer period of time would make more sense, because it's not something that's going to heal over a short period of time. And it's going to be held once a week on Fridays, and it's going to be from 9 a.m. to 12 p.m.
Environment. I kind of struggle with this one a little bit because I think it's a little bit repetitive, but it's very important that you have the right elements in an environment to make sure that the group proposal, if implemented, it would be successful. So this group, obviously, I said before, it could be implemented at cognitive behavioral therapy and Meridian Services, or any mental health care facility or alcohol and other drug treatment facility, where these members are already engaging and doing groups on a daily or weekly or even monthly basis. So it's a familiarity. And if they're brand new to the group session, these places would be ideal because they already are set up to have the room space, the ideal location for these groups to be implemented at. Plus, the staffing is already paid, so that there wouldn't have to be any extra finances or resources that would have to go to the funding of those facilities. Also, many clients who are engaged into treatment at either or facilities already have medical coverage. And obviously money isn't everything, but when it comes to being able to run your group and make sure it's successful, you have to bill for the therapy that you're doing in order to keep it being a successful form of therapy. So that would be a necessary component also. And if they don't have medical coverage, if you already go into agencies that are already set up, most of them like have mental health, county mental health board funding set up. And I know with like Meridian Services, they have funding set up only for women, and is state board funding, to where they can utilize those resources so that every single woman who is experiencing any type of trauma inflicted into their lives would be able to benefit and have the opportunity and the chance to engage into this group therapy sessions. Things like coffee, water, creamer, coffee cups, and a coffee pot would have to be at the facilitator's personal financial resources. And they would have to cover those costs of those items, which when building group cohesion, it's very important to have the coffee and the water and things like that, because that's a place that everybody in the group will go to, and they have outside conversations outside of the group during breaks and things like that. So you want to have those things so that people also feel relaxed and feel comfortable, so that they can really work on their issues. If you feel comfortable and you build group cohesion, then the success rate of the group and the environment that you're placing your members in is going to have a huge and vital outcome of how your group will be successful or not. And also, medical insurances and county job family services can also assist in transportation and childcare if those become issues that, these women, that's inhibiting them from, achieving, their